Somewhere between 1 in 8 and 1 in 5 women died giving birth in the ancient world, and she walked into it anyway, because there was simply no other way. Every woman who went into labor knew that number not as a statistic, but as a face, someone she had sat with and eaten with her whole life. For 300,000 years, every single human birth happened with no hospital, no doctor, no painkillers, and no sterile anything. Just a woman, the people around her, and whatever knowledge had been passed down by whoever came before. They weren't guessing. It just wasn't always enough. The first thing you picture about ancient birth is probably wrong. Not a cave, not chaos, not screaming alone in the dark. Anthropologists call it birth seclusion. The birthing woman was deliberately separated from the main group because blood attracted predators. A leopard could smell it from half a mile away. But there's a second reason harder to sit with. Birth and death happened in the same place so often that ancient cultures psychologically linked them. That wasn't superstition. That was pattern recognition built from watching women walk away from the group and not come back. But here's what will actually surprise you. She was almost never alone. Wenda Trevathan, an anthropologist who spent decades studying prehistoric birth, found that assisted birth is one of the oldest, distinctly human behaviors ever documented. It predates agriculture. It may predate language itself. These were the world's first midwives. They knew squatting made labor faster because gravity has always worked the same way. They knew which plants slowed dangerous bleeding afterward. The Ebers Papyrus, dating to 1550 BC in Egypt, describes specific herbal treatments for birth complications. But those treatments were the written version of knowledge already passed, mouth to ear, woman to woman, across thousands of years before anyone wrote any of it down. These women were not guessing. They were the most experienced birth specialists their world had ever produced. And even with all of that, there was one thing killing babies that nobody in that room could see, and nobody would understand it for another 300,000 years. In a typical prehistoric band of 40 people, there might be 10 women of childbearing age. Statistically, 1 or 2 would not survive their births. Not across a lifetime, just one birth, one time. And that was it. And then there were the babies. Somewhere between 30 and 50% of children in prehistoric populations did not survive to age 5. Archaeologists found something quietly devastating in burial sites from this period. Infant graves are the most common graves found. In some sites, they outnumber adult burials significantly. And yet those same graves show red ochre placed carefully over the remains of children who lived only days. These were not people who loved their children less. These were people who loved their children with full knowledge of what they were probably going to lose. A practice shows up again and again across completely unconnected ancient societies. Anthropologists call it naming delay. A newborn wasn't given a name until it survived a specific window. 3 days. A week. Sometimes longer. Because giving a name meant grief had a target. Anthropologist Nancy Shepherd-Hughes documented this still alive in rural Brazil in the 1980s. The grief was real either way, but the name made it permanent. Now here's the thing nobody in that room could see. Nobody cut the cord with sterile scissors. Sharp stone, shell, reed, in a world with zero understanding of bacteria. The leading cause of newborn death after birth complications was almost certainly neonatal tetanus entering through that cut cord, killing within days, looking like a baby simply going rigid and stopping. They had explanations. Wrong wind, evil eye, bad timing, everything except the actual answer, because bacteria wouldn't be understood for another 300,000 years. They watched babies die and had no idea they were the cause. That is the part that stays with you. Right now, somewhere a woman is in labor with monitors, sterile tools, pain management, and a room full of people trained specifically for this moment, a survival rate that would have looked like magic to every woman who came before her. And most of us don't think about it once. For 300,000 years, the women who built every civilization and handed the entire human story forward did it in the dark, in pain, knowing survival was never guaranteed. They did it anyway, every single time. And the fact that you're sitting here right now means at least one of them made it, every single time it needed to matter. This channel tells the stories of ancient humans. Nobody bothers to tell the uncomfortable ones, the unglamorous ones, the ones that make you realize how recently we stopped living like this. Subscribe, because next week we're going somewhere equally buried. And if you want to stay in it right now, the next video is already there.